And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. Breast cancer, we just can't seem to get away from it.
Well, I mean, it's huge, and there's a lot of research, a lot of attention, a lot of medications, a lot of doctors, so there's always going to be a lot to talk about, primarily because of the research and the attention paid on breast cancer. We've talked before that not all cancers get their fair share of attention, but breast cancer does. So as the segment indicates, this is one option for patients after a lengthy discussion with their oncologist or their primary care physician to figure out what they think is the best thing for them. Obviously, some people would decide against that. Nothing is guaranteed, but as long as you have all the information and you're comfortable with that decision, that's really how most people
It's your body.
It's your body. There's so much information out there. I think it's difficult for patients to do it by themselves. They need to go talk to the expert, the doc, to figure out what to do.
All right, on to our viewer questions. We've got lots of them, so let's get right to it. My wife has a kidney stone. What's the best thing to drink?
Really just plain old water, because a lot of times in the summer months we get a little dehydrated, it's hot, it's humid, and that's what creates these stones. A lot of times just dehydration. Sometimes lemonade works really well because it has a certain chemical inside that helps dissolve or prevent the formation of kidney stones. Sometimes there's a tablet called potassium citrate that can be prescribed. The bottom line is to find out what type of stone it is, and then we can kind of figure out the chemistry behind the stone and make recommendations, but water is the best thing.
Okay. What's the best type of vitamin to take daily to reduce failing health and death stemming from poor health?
We get this a lot. Actually, as a physician, we like patients to consume their vitamins in the foods, vegetables, fruit, fish. If you cannot do that, certainly over-the-counter vitamins are okay, are acceptable. No particular brand is recommended over another, although you hear a lot of things in the magazines, on TV, but no particular brand is recommended over the other.
Is it good, just multivitamin, good enough?
We like Centrum Silver, but I just don't want people to spend too much money on some of these vitamins. Some of it is hype. It's not studied like a lot of the medicines I prescribe, and that's the problem. From physician's standpoint, we make recommendations on certain types of studies, and a lot of the vitamins just don't have those type of studies, so we don't promote it.
You're going to avoid most of the vitamins anyway, correct?
Oh, absolutely. But a lot of times if you just eat that healthy diet, it's going to have all that in there. Right. If you're eating the 5 servings of fruits and vegetables a day, which is what they recommend, so you don't necessarily have to go out and buy separate vitamins. Just get it in the food. Okay.
Another question. My white blood cell count is 14.8, and the doctor said it was high, but really all he keeps doing is rechecking it. What is the count supposed to be?
Yeah, actually between 5 and 10. 14 is a slight elevation as compared to 25 or 35, which is a lot higher.
What does that mean, though, to have a high white blood cell count?
A lot of times when it's a low like that, a low high, I should say, maybe some dehydration, vomiting, maybe they had a slight infection, bladder infection, cold or flu, some sort of inflammation, they injured themselves, mild arthritis. Normally the trend is really what tells us what's going on and symptoms based on what the patient's talking about. So if that continues to rise, then I'm concerned.
Okay. This person had a knee replacement almost a year ago. The pain is staying persistent and even had a little maybe metal splinter come out of their knee recently. The joint pops back into place after trying to stand. It hurts to sit and to lay down. What's your honest opinion?
They're probably going to get back to the surgeon.
Ooh,
if there's anything metal
coming out?
Yes. If there's anything metal coming out, please get to your doctor.
All right, We've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This woman has a red itchy rash. It goes away during the day, but overnight it comes back. What could it be?
Could be maybe something in the bed sheets, lotion, a cream, a soap. Obviously something's irritating the skin. Our skin is in contact with so many different chemicals throughout the day, but seems to be a pattern. I probably would try a steroid topical cream initially. If it doesn't go away, certainly get to your doctor or dermatologist maybe for biopsy.
But you can't get the steroid cream over the counter,
You
correct?
can. They have a really low potency, which can be tried, and certainly the prescription is a lot stronger, so you can try that initially, absolutely.
Okay, this woman has neuropathy. She takes medicine for it. Over the weekend, she had severe pain all over her body. Is it getting worse or progressing, or is it something else?
It could be something else. It's sometimes very difficult. Neuropathy is a lot of times diagnosis of exclusion. There's no chemical test or x-ray that says it is neuropathy versus another. So just get with your physician. A lot of times if we think it is a neuropathy, we can adjust the medication, but based on the patient's history and physical exam, we can maybe consider other illnesses that may also contribute.
Okay. 77-year-old woman had a stent in her heart because it was 90% blocked, but now she has more trouble breathing. Could the two be connected?
Absolutely. You know, stent is a man-made material. Certainly the procedure may not go as well as planned. That's with any procedure. There are no guarantees. So certainly if you have symptoms after that, get back with your physician, because if the heart doesn't get proper blood flow from narrowing, from a stent that didn't do well, then you can't breathe because your heart can't work and you get short of breath. You can get fluid in your lungs, so certainly get back with a cardiologist.
Okay. Man has very sensitive knots on his heels. What could it be?
Well, again, the skin comes in contact with so many things. Could be something in the shoe, the sock. Certainly some injections of topical agents might work really well, might need a biopsy, but certainly nothing to be ignored.
Okay. Another question. I had an abscess tooth pulled and the abscess did not come out with it. The dentist put me on antibiotics and the abscess is still there. That has to hurt. He referred me to an oral surgeon. Do you agree, or should I go to my medical doctor? The abscess is in the roof of my mouth.
I think if it's getting better or it's about the same, it's okay to just follow up with the oral surgeon. I think if it's getting worse, sometimes it's hard to get into an oral surgeon. Certainly check with your medical doctor. They might be able to make a few phone calls, especially if it's getting worse. But if it's stable, probably just wait for that appointment. Keep taking the antibiotics.
Okay. What can you do for delayed digestion? I had a gallbladder surgery in 2009. Digestion started being delayed in 2011. I've tried diets, probiotics, meds, etc. Still having problems.
We try to find a reversible cause, whether it be diabetes, thyroid disease, medication side effects, constipation. We have one medicine which is called a probiotic. It's called Reglan, a metoclopramide. Not necessarily a safe product long term. You've seen commercials on TV about lawsuits, but we still use it because it still works, and I think for a person like this who's struggling, maybe low dose periodically might help them.
Okay. What prevents UTIs?
We try to find a reversible cause. Sometimes they have structural abnormalities. Untreated diabetes might have possibly a malignancy inside the bladder. So we try to identify what is causing it and then fix that. But there are ladies who have no reversible cause. We see it a lot in the elderly population. Sometimes they have to take the antibiotics daily for several months.
Okay, and unfortunately we are out of time. We've got lots of other questions, but we'll have to get to those next Monday.
All right,
we appreciate
we'll be here.
you
Yes,
being
ma'am.
here. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, or email us at laf@kftm.com, or better yet, post those questions every Monday on our KFDM News Facebook page.